Okay, next we're going to go ahead and cover trigger point therapy on the trapezius muscle. So the trapezius is named after its large trapezoid shape that happens from both sides of the muscle. So it's a large fanning muscle. It attaches, or its origin points are all the way up to the occiput, all the way down the cervical and thoracic spine, down to about the T7 spinous process. And then its insertion point is on the medial aspect of the scapula here, as well as onto the spine of the scapula out to the sides. And I believe part of it even inserts onto the distal 1/3 of the clavicle. And the primary function of the trapezius is retraction, especially for the middle fibers, and elevation of the scapula primarily for the upper fibers. And the middle and upper fibers are primarily where we will be doing our trigger point therapy, since the lower traps are more inactive with shoulder pain patients, and they primarily need to be strengthened rather than perform trigger point therapy on. So when I perform trigger point therapy on the trapezius here, I'm going to have Kristen take her arm. She's going to grab the bottom side of the table. This is already going to add a little bit of stretch to the trapezius. She's going to lean her torso away, and then she's going to go into lateral flexion of her neck. When she's in this area here, all this muscle is on a nice big stretch. I'm going to take a pinch grip on the front side of the trapezius and on the back side, and I will assist her in going into additional lateral flexion, and I can even play around with a little bit of flexion and rotation of the head here, just to get to different aspects of the muscle that may need addressed. And then I can also change around where I'm gripping and where I'm placing pressure to change up where I'm performing the trigger point therapy here on the traps.